there is an op-ed in today's Wall Street Journal. Today is Monday, January 10th, 2022, and I think this op-ed is going to be important. I've been wrong about this sort of thing before. Sometimes the things I think are important, nobody else pays any attention to, but this one, I think I'm right, and the op-ed is, I'll tell you about it in a moment. The authors, first of all, are one constitutional lawyer at Yale, Jed Rubenfeld, and the other is Dr. Luc Montagnier, who in 2008 won the Nobel Prize for Physiology or Medicine for the discovery of the human immunodeficiency virus. Now, a word of caution about Dr. Montagnier. According to Wikipedia, quote, during the COVID-19 pandemic, Montagnier was criticized for using his Nobel Prize status to spread dangerous health messages outside his field of knowledge for promoting the conspiracy theory that SARS-CoV-2 was deliberately created in a laboratory. Such a claim has been refuted by other virologists. I'm just going to share screen for a moment, and just so we can look at Wikipedia. The other thing, among many other things, the other thing that Wikipedia also says is something about statistics of the COVID-19 pandemic in mainland China. I think this is useful to know when you're considering whether to take a word of warning, a word of caution from the individuals who contribute to and moderate Wikipedia, how much weight to give it, to give that word of caution. And one way to weigh that, one way to kick the tires, as it were, is to take a look at how Wikipedia reports on and presents evidence about other issues in the same field. And this article in the Wall Street Journal by Dr. Luc Montagnier and Jed Rubenfeld is about vaccinations and COVID-19 and where things are going right now, and I'll get to that in a moment. It's useful to look at what Wikipedia says about stats in China. Here, around March 2020, there was speculation that China's COVID numbers were deliberately inaccurate, but now China's COVID elimination strategy is considered to have been successful and its statistics are considered to be accurate. Doesn't say by whom, passive voice, so somebody considers them accurate. And what are the statistics? Well, according to Wikipedia, let's look at this. Mainland China, deaths from COVID-19, 4,634. That's the raw number. That's not per million or per 100,000. The total number of deaths in China, 4,634. And if we compare that with, say, the World Health Organization, that's similar. So World Health Organization says that about 830,000 deaths in the United States from or with COVID-19, in Britain, 150,000, in Ireland, 5,952 deaths, and in China, 5,699 deaths. So the World Health Organization, like Wikipedia says, the total number of deaths in China is about the same as the total number of deaths in Ireland. There are more in Ireland, apparently, according to the World Health Organization. So that uncritical comment from Wikipedia about the number of deaths from COVID-19 in China is worth bearing in mind when you're trying to assess the validity of, or give weight to, the criticism of the author of this study, of this op-ed in the Wall Street Journal, which refers to studies into the effect of vaccinations on people right now in Ontario and in Denmark. So let's look at what the op-ed is saying. Op-ed says, one preprint study, and there's a link to it on the Wall Street Journal and on my website, petervickery.com. One preprint study found that after 30 days, the Moderna and Pfizer vaccines no longer had any statistical significant positive effect against Omicron infection, and after 90 days, their effect went negative, i.e., vaccinated people were more susceptible to Omicron infection. Confirming this negative efficacy finding, data from Denmark and the Canadian province of Ontario indicate that vaccinated people have higher rates of Omicron infection than unvaccinated people. Okay. Is that what the data from Ontario really say? Let's take a look. Go to share screen and look at hospitalizations by vaccination status in Ontario. Right now, and this is the most recent data. Okay, I'll scroll up. Last updated January 10th at 11:15 a.m. and hospitalizations by vaccination status in Ontario. Ontario population about 15 million, by the way, so we're not looking at huge figures here, mercifully. This is the total number of people hospitalized with COVID-19 in Ontario right now. But 1,300 of them are fully vaccinated, 1,353. 115 are partially vaccinated, and the number of unvaccinated people hospitalized with or for COVID-19 is 457. The number of people in hospital in Ontario because of COVID-19 are fully vaccinated. When you look at the ICU numbers, fully vaccinated 137, unvaccinated 123. The majority of people in intensive care with COVID-19 in Ontario are fully vaccinated. And that's what the authors of this op-ed in the Wall Street Journal are talking about. So as an attorney, what I'm interested in is what are the implications for employers and employees. Many people got vaccinated because their bosses gave them the option, get vaccinated or there's the door, get vaccinated or get fired. And what if they chose option A, they got vaccinated, and then because they got vaccinated, not in spite of, but because of the vaccine, they got COVID-19 and got sick. Now, would the pharmaceutical companies be liable? A touchingly naive question. No, don't worry about them. Congress is taking care of them. Would the government be liable for urging employers to give their employees this ultimatum? Get the vaccine or be fired? No. What about employers? Are employers liable? I think so. What about the situation where somebody requested, say, a religious exemption? And the employer said, well, we acknowledge that you have sincerely held religious belief that prevents you from getting vaccinated, but we cannot provide any reasonable accommodations because no amount of accommodating, no amount of testing, social distancing, masking, PPE, no amount of all that will keep your co-workers and the public safe. So no religious exemption for you, you're fired. Now, what they're supposed to do is see whether reasonable accommodations are possible. And now, what if it turns out that the unvaccinated employee who wanted a religious exemption is less of a threat to those co-workers and to the public than the vaccinated employee? Do they have a cause of action? I think so. Check out the website, petervickery.com.